This presentation provides an overview of Attention Deficit Hyperactivity Disorder, or ADHD. In this presentation, you will learn about the definitions of ADHD, prevalence and causes of ADHD, characteristics of students with ADHD, and best practices for educating students with ADHD. ADHD does not have a special education definition in the federal law because ADHD is not recognized as a single category in special ed law or under IDEA. A child can be eligible for special education services under other health impairment or OHI and receive an IEP if ADHD significantly impacts the student's educational performance. If the student only needs accommodations to address their unique needs related to having ADHD, the student typically has a 504 plan that details the specific accommodations needed by the student. The difference between a 504 plan and an IEP is that a 504 plan only has accommodations, whereas an IEP has much more included in addition to accommodations, such as annual goals and objectives, related services, least restrictive environment, any behavioral supports needed, transportation supports, etc. The symptoms of some students with ADHD are controlled by medication, and they do not need additional accommodations, so they might have ADHD and not have an IEP or a 504 plan. Although there is not a federal definition of ADHD related to IDEA or the federal special ed law, there is an ADHD definition developed by medical professionals. The American Psychiatric Association defines ADHD as a persistent pattern of inattention and/or hyperactivity and impulsivity that is more frequently displayed and more severe than what is typically observed in individuals at a comparable level of development. Other considerations are that some symptoms should appear before the age of 7. The behavior should last for at least 6 months, and that the symptoms must appear across 2 or more settings. Students with ADHD have difficulties with attention, or they display inattention. Inattention is the inability to sustain attention for age-appropriate periods of time. In the classroom, this can lead to carelessness in work, disorganization, distractibility, difficulty following directions, forgetfulness, and difficulty completing tasks. Students with ADHD may have hyperactivity. Hyperactivity is a high level of anxiety that is not appropriate in a particular setting and is not age appropriate. In the classroom, students who are hyperactive may be fidgety, very talkative, and constantly on the go at inappropriate times. Students with ADHD may have impulsivity. Impulsivity means responding without thinking at a level that is not age appropriate. In the classroom, students who are impulsive may blurt out answers, interrupt others, intrude on the activities of others, and have difficulty waiting their turn. Students with ADHD do not necessarily have inattentiveness, hyperactivity, and impulsivity. There are 3 types of ADHD. The first type is the predominantly hyperactive impulsive type. The second type is predominantly inattentive type. This was formerly referred to as ADD, or attention deficit disorder. And then there's the combined type, which these students have both hyperactivity and impulsivity as well as inattentiveness. The estimated prevalence for ADHD in the school-age population ranges from 3 to 7%. This means that general education teachers will typically have 1 or 2 students with ADHD in their classroom each year. As is common with other disabilities, boys are 3 times more likely to have ADHD than girls. 50 to 60% of students with ADHD also have a coexisting disability such as a learning disability, emotional behavioral disorder, an intellectual disability, other health impairment, or autism spectrum disorder. As is common with most disabilities, we often don't truly know the cause of ADHD. ADHD can be a result of many factors such as brain injury, which is only approximately 5 to 10% of the ADHD population, brain abnormalities, which are deficiencies of specific neurotransmitters in the brain that influence the transmission of signals between nerve cells, and hereditary influences. A child is 5 times more likely to have ADHD if a family member has ADHD. Students with ADHD have a variety of different characteristics. Some students have social difficulties, meaning they have difficulty getting along with peers. To read more about relationships with peers related to ADHD, I provided a link here. Students with ADHD also have some behavior problems in many cases. This may include problems with stubbornness, defiance, verbal hostility, and temper tantrums. Students with ADHD may also have academic difficulties. Approximately 70% of students with ADHD will have a learning problem with reading, math, writing, or spelling, and approximately 20% will have a learning disability in reading, an actual learning disability in reading or math. Students with ADHD have difficulties with executive functioning, just as students with autism spectrum disorders and students with learning disabilities do. And these abnormalities occur in the frontal lobes of the brain, which results in deficits in the following executive functions. They will have difficulty with time management, regulation of emotions, planning, forethought, learning from consequences, and organization. There are 2 main treatments for ADHD, medication and behavioral interventions. Most practitioners will suggest first using behavioral interventions before beginning any medication interventions because behavioral interventions do not have side effects. However, there are many students with ADHD who do require medication. Research shows that medication is a very effective treatment for reducing symptoms of ADHD for approximately 70 to 85% of students with ADHD. There is a link here that provides more information on medication and behavioral interventions for ADHD. I do want to point out, though, that it is not appropriate for teachers to tell parents to put their children on medication. Teachers can recommend that parents see a doctor to evaluate any medical needs related to the student's ADHD, but it is not appropriate to tell a parent that if the child was on medication, the child would do much better in school. There are 2 links provided here that provide information about strategies for teaching students with ADHD.